everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be learning about nursing care of a normal newborn. Now, before going to nursing care of a normal newborn, first we need to understand that when we would consider a newborn as normal newborn. So the first thing is that the infant should born at around between 38 to 42 weeks. So I hope you are clear about the idea about preterm and postterm and which is term baby. Here before 37 weeks we call it as preterm. We are discussing about normal newborn. That means it should be between 38 to 42 weeks. And also it should have average birth weight, that is 2500 grams. We have already learned that, if it is less than 2500 grams, then we call it as low birth weight baby. And also it should have average birth weight of 2500 grams. We know that is a normal birth weight. If it is below 2.5 kgs, then we call it as low birth weight babies. We are discussing about normal newborn. And one more criteria of the normal newborn is that the average birth weight, that is 2500 grams. Apart from these things, there are also some sort of factors that the child should cry immediately. And also there should be establishment of independent rhythmic respiration. So there should not be any resuscitation, should not be needed. That is also one more criteria. And the neonate would quickly adapt to the changed environment. Or we can say extrauterine environment. So these are the criterias based on which we can call newborn as normal newborn. Here also a term comes which is essential newborn care. So this essential newborn care is a comprehensive strategy. And through this our main aim is to reduce the death of the newborn. What are the purposes of this essential newborn care? Why we should provide all these cares are there under essential newborn care? So the first point is to make sure that the baby is thriving. Now it is very important for the baby to thrive. So that is one purpose to provide essential newborn care so that the baby would be able to thrive. The next thing is early detection of problems or any danger signs. And along with that, we also help the mother to, meet the basic needs of the baby. That is the warmth, the feeding and the infection prevention. Then with this, we also make sure that the baby is breastfed within half an hour to 1 hour of birth. And then we advise the mother and the family members of what is the importance of exclusive breastfeeding and how to take care of the immunization and what is the importance of growth monitoring. So all these things are, achieved through essential newborn care. The next thing is that this essential newborn care has certain components. The first one is clean childbirth and cord care. So this clean childbirth and cord care is to prevent any sort of infections in the hospital. The next thing is thermal protection. So that is again one more component of essential newborn care. This thermal protection is to basically prevent or manage hypothermia or hyperthermia. And then the third component is early and exclusive breastfeeding. As I told you that through this essential newborn care, we make sure that the neonate is breastfed within first hour of birth. And also with that, we make sure the neonate is getting exclusive breastfeeding. And then there is one more component is initiation of breathing and resuscitation. So that, we can find out there is asphyxia that can be identified earlier and also it can be managed. So we would discuss these components in detail. So we would discuss these components in detail, that is in later slides. But now, before that, we would see what are the routine care that we do for every birth. So the first thing that is very important is call out the time of birth. As a nurse, you have to call out the time of birth and then you have to place the baby on the mother's abdomen. And also you have to dry the baby with warm, clean sheet. It has to be warm because, it's to prevent hypothermia. So we have already, I think, learned that when you receive the baby, you have to receive in a pre-warmed towel. So that is because that's to prevent hypothermia. So here also when you are drying the baby, you have to make sure that you're not using any sort of cold items. You have to use warm, clean sheet. And then you have to wipe the mouth and the nose of the baby with a clean cloth. And while doing that, you have to assess the baby's breathing. So you have to see whether there is spontaneous establishment of spontaneous breathing, or the baby is having any kind of birth asphyxia or apnea. So these things you have to assess while you are providing this care. And then there will be clamp cord. And then after 1 to 3 minutes, we are going to clamp the cord. And then we have to put the identity label on the baby. These are some general routine care that we do for every childbirth. And we saw that in nursing care of normal newborn, we had certain components. Those components were in general that we are going to do. But here again, we have certain components. Now the next thing is that prepare for child's birth. So in preparation for baby's birth, it's the first and foremost thing, and it's very important that preventing infection. So for that, we have to do hand washing thoroughly, and then we have to use all the infection prevention steps. Next, we have to check the equipment, the supplies, the linen, everything that we're going to use. It should be sterile. There should be decontamination and disinfection and sterilization of the equipments. Apart from these, you also have to make sure that the health personnel, they are also wearing gloves, eye protection, shoes, face mask and apron. So this is also to protect themselves from the splashing of blood, etc. This is about prevention of infection that we are going to do, preparation of baby's birth. Next thing is we have to prepare the birth rooms. Where the childbirth will happen, we also have to prepare that room. So the first thing, again, the cleanliness of the room. The room should be cleaned properly. It should be warm to prevent hypothermia, to prevent any kind of unnecessary heat loss. There should be adequate light and it should be private. So it should provide privacy to the mother and the child. After this, as a nurse, you have to keep the records. So what are the records that you are going to keep? So first thing, you have to arrange the newborn record cards, the immunization cards, and then the mother's records. Before the pregnancy and during the pregnancy, during the labor, everything, whatever record is there, that you should keep. And then you should collect the equipment and the supplies that you need for the birth in the immediate postnatal care. So this was about, preparation of child's birth. Now the next thing is immediate newborn care. Now as the child is coming from intrauterine life to extrauterine life, there would be certain requirements, certain needs. So based on that, we need to provide certain immediate care. In that, the first thing that we're going to do is maintenance of temperature. Now we know that there are some ways we lose heat from our body. But if we see newborn, they lose their body heat in 4 ways. That is convection, conduction, evaporation and radiation. So these are the 4 ways through which a newborn loses heat from their body. So how we can maintain temperature in them? The first thing is we have to immediately dry the infant under the radiant warmer, and then we can provide skin to skin contact with the mother, and also the head of the neonate should be covered and the feet and the hands also should be covered. And we can practice rooming in also. The mother and the baby should not be separated. If we keep them together and if there is skin to skin contact, in that case, that is how we can maintain temperature. So to maintain temperature, we basically follow a warm chain. Now what is this warm chain? Now as we are discussing from the very first, that when we were preparing for child's birth and while preparing the room, the articles, equipments, everything, we always said that it should be warm. We should receive the baby in a pre-warmed towel and we should immediately dry the baby to prevent hypothermia, right? So the first thing that we did is warm delivery room, where also we are trying to maintain the temperature. Once the baby is born, after that we dry the baby immediately. That is also to prevent hypothermia. And then we provide skin to skin contact and then we start breastfeeding. Through all these things, we are following a warm chain, or we are making sure that there is no heat loss, unnecessary heat loss, and we are able to maintain the temperature, maintain a stable body temperature of the neonate. We are kind of following a warm chain. Then also we postpone the bathing and weighing the infant, because that would again expose the infant towards a cold. We usually postpone that to prevent hypothermia. We also make sure that there is appropriate clothing and practice rooming in, where we keep the infant and the mother together. And if we are taking the neonate from one place to another place, from one ward to another ward, we make sure that there is, while transporting the neonate, that time also there is maintenance of temperatures. There is warm transportation. Now in all these things, we are kind of following a warm chain, or we are trying to maintain a stable body temperature for the neonate. So this is how we do the maintenance of temperature. The next thing is establishment of open airway. Now here, majority of the neonates, they cry at birth and they take spontaneous breathing. Now here, one thing is that majority of the babies, they cry at birth and they start spontaneous respiration, right? So what happens actually when the head is delivered, the attendant, the nurse, as a nurse, what we do is we immediately suction the secretions. So whatever is there that might be, blocking the airway, to remove those secretions, we do suctioning. And we also wipe the mucus from the mouth and nose. Why this suctioning is important? We say that once the head is delivered, we are providing suctioning, right? We are removing the secretions, whatever is there that is blocking the airway, and we are, wiping out the mucus from the mouth and the nose. But why is it so important? Why it's important to suction? Now, one natural mechanism is that when the fetal chest passes through the birth canal, it gets compressed, squeeze the excess fluid out of the lungs. At this time, the fetus is partly delivered, because that time when the chest is compressed, at that point of time, only the head is delivered, right? So we can say it is, the fetus is partly delivered. So after several seconds, part delivered position, we can see the fluid is streaming out of the baby's mouth and nose. And then once the fetus is delivered, after the birth, there will be coughing reflexes, sneezing reflexes, and through that, there would be mobilization of the extra fluid that is present in the lungs. So this is why suctioning is very important, to remove out the secretions or to the excessive fluids. And then after suctioning, we have to keep the head of the baby a little bit lower than the body, and then we can position the baby on their back, or little bit tilted on the side, but not to their stomach. So that would make them difficult to initiate the breathing. Well, after establishment of open airway, there is newborn identification. So as a nurse, you have to make sure that before the newborn leaves the delivery area, have to put the identification bracelet. Well, once you do newborn identification, then the next thing is that is vitamin K. Now, you know that vitamin K is administered at birth. Well, so if it is a preterm newborn, in that case, we are going to give 0.5 mg. But if it is a term infant, in that case, we are going to give 1 mg of vitamin K. And this is to prevent neonatal hemorrhage during the first few days of their life. Once these things are done, the next important thing is breastfeeding. So initiation of breastfeeding is very important. When we should initiate? Now we know that there should be exclusive breastfeeding. It should start within 1 hour of birth or within 30 minutes of birth. But which would indicate you that now you can initiate breastfeeding? Babies can be breastfed as soon as the airway is cleared and they are breathing normally, and there is establishment of normal breathing pattern. Once this is done, newborn can be started with breastfeeding. Next, we would see what are the daily routine care of neonates. So here, the majority of complications of the normal newborn that may occur during the first 24 hours or within 7 days. So that is why this period of time is very important, and you should provide close observation. And daily essential routine care is very important for the neonate to be healthy and to survive. With this daily routine care, our two major goal is to establish and maintain the homeostasis and also to stabilize the normal physiological status. Well, so what are the daily routine care of neonates that we should follow? The first thing is warmth. So we have to maintain the warmth. Second thing is breastfeeding, which is very important. So there should be exclusive breastfeeding. And then there is skin care and baby bath. After that, we also have care of umbilical cord, then care of the eyes, clothing of the baby. Then there is general care, observation, then taking anthropometric measurement, and then immunization, and then follow-up and advice. This is what is daily routine care of neonates is composed of. We've already seen that how to maintain the temperature. The same thing here also. How we are going to provide the warmth. We have to make sure the extremities are covered, the head is covered, and we have to keep the baby dry, and we have to wrap the baby with cloth. And then there is breastfeeding. So the baby should be put to a mother's breast within half an hour of birth, as soon as the mother has recovered from the exertion of labor. Then coming to skin care. Before you present the newborn to the mother, you should clean the skin gently, clean the blood, the mucus, and the meconium. That should not force it. You should gently wipe it out. And then about baby bath. So that can be given at hospital and at home also. So once the baby's temperature has been stabilized, the first bath can be given. But we have to make sure that whenever we are providing bath to the newborn, we have to follow certain instructions. So we have to make sure that we provide the bath in a warm room and with warm water. Then you should dry the baby from head to toe to prevent hypothermia, and providing bath in an open place should be avoided. And then unnecessary exposure should be avoided, and also during the winter times the baby should have sponge bath rather than deep bath to avoid cold stress or hypothermia. So this was about skin care and baby bath. Now the next thing is care of the umbilical cord. When we cut the umbilical cord, we cut it at around 2 to 3 centimeter from the navel. And while cutting this umbilical cord, or while taking care of the umbilical cord, we have to follow all the aseptic technique. And while cutting umbilical cord, or taking care of the umbilical cord, we have to follow the aseptic technique. So you have to inspect the cords afterwards to see if there is any kind of bleeding. Now bleeding, that is usually that happens because of the shrinkage of cord and loosening of the ligatures. That you have to check if there is bleeding from that, and you should make sure that there should not be any dressings applied on the umbilical cord. It should be kept open and dry. So normally it falls off after 5 to 10 days, but in case if it is infected, in that case it might take longer. And you have to make sure that the cord is kept free of any sort of ointment. So you should not apply anything on the cord, and you also have to instruct the family members and the parents, the mother, that not apply anything on the umbilical cord. Let us see how to take care of the eyes. Eyes should be cleaned at birth, and then every day once you should clean the eyes. And while cleaning the eyes, you have to make sure that you use a sterile cotton ball. You can use a sterile water or normal saline, and you can dip the sterile cotton in that, and then you can clean the eyes. Now here, for each eye you should use a separate cotton swab. Also you have to make sure that there is no application of kajal. You have to instruct the family members to not to apply kajal or any sort of like that, because that would cause infection or lead poisoning. And then while cleaning the eyes, you have to observe if there is redness, there is sticky discharge or excessive tearing. So if you find any of these things, then inform to the pediatrician and you should take prompt management. The next thing is that how the clothing should be. So the baby should be dressed with loose, soft and cotton cloth, and it should be open from the front or the back for easy wearing. And then you have to make sure that the clothes are not tight around the neck or abdomen. And then you have to instruct the mother and the family members that the clothing of the baby should be cleaned with very light detergent, that should be washed properly and should be sun-dried to prevent skin irritation. Now, what are the general care that should keep in mind? Here, two important things are there, that is bedding in and rooming in. Baby should be kept with the mother continuously. There should be skin to skin contact until and unless it is contraindicated. And whenever you are handling the baby, you should do it with gentle approach, and you should always make sure that do proper hand washing before handling the baby. One more thing is you can make the baby to sleep in supine position, because that would prevent sudden infant death syndrome. Next is observation. So this is, as a nurse, it's your responsibility to provide. So the baby should be thoroughly observed twice daily, and this would help us in early detection of any kind of abnormalities. And then the temperature, the heart rate, the breathing pattern, Also, the feeding behaviors, stool of the baby, urine, and the sleeping pattern, these things also should be assessed. Apart from these, the mouth, the eyes, and the umbilical cord and the skin should be looked for any sort of infections. After this, the next thing is weight recording. So if we see the average daily weight gain in healthy term babies, it is about 30 grams per day in the first month of their life. And then in the second month, it is around 20 grams per day, and then 10 grams per day afterwards during the first year of their life. Most of the infants, they double their birth weight by at least 4 to 5 months of their life. There is physiological loss of body weight. Now, this is due to removal of vernix caseosa, then removal of mucus, blood, passage of meconium, and then reduction of extracellular blood volume. So that is what basically happens in the first week of their life. It is very important to monitor the weight and to record the weight to understand that if there is any sort of problems that is happening that might be detected earlier. And then after that we have immunizations. So I think you all are aware about the immunization schedule, national immunization schedule that we have already learned. And at birth what are the vaccines that we should give. So we basically give BCG, and then we give hepatitis B, we also give OPV. So we have to provide these vaccines. We have to make sure that the child is immunized at proper time. And we also have to instruct the family members and the parents that what is the importance of immunization, to which age the child would receive what vaccine, or what is the next vaccine that the child would receive. And then there is follow-up and advice. So follow-up is very important for the infants. So each infant should be followed up at least once every month for the first 3 months of their life, and then subsequently 3 months interval at till 1 year of age. So with this follow-up, we can assess the growth and development. We can also do early detection and management of health problems. And along with that, we can also, educate the family members and the parents about prevention of childhood illness. So this was all about nursing care of normal newborn. So I hope you have understood the topic well and you have got a better insight about the topic. Thank you.